This is the Collaborative Stage Data Collection System, CS Moments. The topic for today is breast site-specific factor 6. The size of the invasive component is known in a mixed tumor. I'm Donna Gress, AJCC Technical Specialist. So the question that we want to cover is, how do I code site-specific factor 6 for a mixed tumor if the size of the invasive component is known? Here's scenario number 1, which has a 2.8 centimeter tumor that's invasive, and there's also ductal carcinoma in situ also present in the specimen. The answer for site-specific factor 6 is 020. The pathology report stated that there was an invasive tumor which was 2.8 centimeters. The CS tumor size will be recorded as 028. Since that was the size of the invasive tumor, you need to capture the fact that the size of the tumor you're recording has an invasive behavior. However, there was also an in situ tumor present, so you cannot code 000 for site-specific factor 6. You need to indicate that besides a 2.8 centimeter invasive tumor, there was also an in situ tumor present in this breast cancer. Use code 020, invasive and in situ components present, but size of the invasive component stated and coded in the CS tumor size. Now let's look at another scenario. This is a segmental mastectomy which had a 4.4 centimeter invasive carcinoma, and there was ductal carcinoma in situ also identifying, making up less than 25% of the total tumor mass presented and mixed with and away from the invasive component. Now the answer would be 020. In this scenario, you are once again given the size of the invasive tumor. The size is stated to be 4.4 centimeters, so you would record CS tumor size as 044. There is also in situ tumor present, and the path report states that this constitutes less than 25% of the tumor. However, do not use code 030 for site-specific factor 6, since you do know the size of the invasive component and you recorded that in the CS tumor size. Now let's look at the next scenario. This is a modified mastectomy. The tumor size is 3.8 by 2.5 by 2.8, and the tumor is composed mainly of intraductal carcinoma in situ with the focus of invasive carcinoma. The answer would be 020. This tumor is composed mainly of DCIS, and the entire tumor is stated to be 3.8 centimeter in largest dimensions. However, there is an invasive component stated to be only a focus. Don't forget that microscopic focus, foci, or microinvasion is captured in CS tumor size as 990. Code CS tumor size as 990 and use code 020 for site-specific factor 6 to show that you've captured the invasive tumor size, but there's also an in situ component. It doesn't matter how big the in situ component is. For more information, you can check out the references, Part 1, Section 2 of the Collaborative Stage Manual version 0205 under Breast Site-Specific Factor 6. You can also find more information in the Part 2 schemas for breast, collaborative stage tumor size, and also in the CS site-specific factor 6. Be sure and submit your questions to the CAnswer Forum, specifically to the Collaborative Stage Forum within the CAnswer Forum. This provides information not just for you and an answer, but it also provides information for all the registrars who will read this question and answer. It also allows us to look at the types of questions being submitted and help choose which one should be the focus of the next video. Please check out the AJCC YouTube channel. There are many short videos here on both AJCC and Collaborative Stage. It covers very many important concepts. We have also posted all of the Collaborative Stage topics on the Collaborative Stage webpage because we know registrars do not always have access to YouTube at their facility. This has been sponsored by the Collaborative Stage Version 2 Education and Training Team and by AJCC, the administrative sponsor for Collaborative Stage. Thank you.